When someone gets diagnosed with high blood pressure, the advice is almost automatic. Cut out the salt. And that sounds reasonable. I mean, it's simple and it feels actionable, but here's the problem. For many people, that advice is incomplete at best, and at worst, it sends them in a completely wrong direction. And not because salt is irrelevant, it's not, but because salt is only one small piece of a much larger problem. So when you focus on salt or sodium alone, you ignore the real drivers of why blood pressure went up in the first place. So in this video, I want to walk you through the real causes of high blood pressure that often get overlooked. And these are the things that you can actually act on today. And in many cases, once you fix these, your blood pressure will come down quickly without any medications. So what we're going to talk about is nutrient deficiencies and metabolic factors and hormonal drivers that cause high blood pressure. Because once you understand these often ignored driving forces, you'll see why the usual one-size-fits-all advice never gets to the root cause of the problem. And it's why so many people end up with a chronic condition and are forced to stay on medications long term. So first, let's go over why focusing on salt or sodium is often not enough or completely misleading. So the way this works is sodium raises blood pressure by pulling water into the bloodstream, and this in turn increases your blood volume, which can then raise your blood pressure inside your arteries. So that part is true, but what rarely gets explained is what happens next in a healthy body. If your kidneys are working well, they sense that rise in blood pressure almost immediately, and in response they excrete excess sodium and excess water through the urine, and as that excess volume comes down, blood pressure comes back down with it. And this mechanism works remarkably well in healthy individuals. So this is why many people can eat salt or eat foods with a high sodium content without developing high blood pressure. And that's why there's such a wide variability in salt sensitivity from person to person. Some people are very salt sensitive and others barely respond at all. So when blood pressure stays high even after you cut back on the sodium, that tells you something important. The issue is then not the sodium that you're eating. The issue is how your body is processing it. And this is where the real causes of high blood pressure start to show up. And one of the first things I look at is magnesium. So magnesium plays an absolutely critical role in blood pressure regulation. So magnesium boosts nitric oxide and prostacyclin, which both of those things help relax and widen your blood vessels. So when magnesium is low, blood vessels stay more constricted than they should, and that makes it more difficult for blood to move. So this is what causes your blood pressure to go up. And the reason I emphasize magnesium is because low magnesium is very common. Some estimates say almost half of the US population does not get enough magnesium through their diet. And we see this in observational data too. There's a meta-analysis of 22 studies that found that people with lower magnesium levels had higher odds of high blood pressure. And the lower the magnesium, the higher the risk. So why are so many people deficient in magnesium all of a sudden? Well, a big part of it is the food that we eat. So we're talking about refined grains and sugary foods and processed foods. These foods lack many essential minerals, including magnesium. And eating a lot of sugar also makes your body lose magnesium in your urine, which then makes the problem even worse. And even if you do get enough magnesium through your diet, on paper, you may still not be getting enough. And that's because modern farming often pulls minerals out of the soil faster than they're being replaced. So the food looks the same, but it has less magnesium than it did just a few decades ago. So how would I approach this is I would still try to prioritize magnesium-rich foods. So it would be foods like leafy greens and legumes and nuts and dairy, but just know that even a good diet today gives you less magnesium than the same foods gave people in the past. So for that reason, many people would actually benefit from taking a magnesium supplement. And this is definitely something to discuss with your doctor if you have high blood pressure. There's a recent meta-analysis of 38 randomized control trials that found that magnesium supplementation with a median dose of 365 milligrams per day for 12 weeks had small but meaningful reductions in both systolic and diastolic blood pressure. And the blood pressure lowering effect was even greater in people with high blood pressure who were taking medications. In that population, magnesium supplementation resulted in almost 8 millimeters of mercury drop in systolic blood pressure. Now, let's talk about insulin, because insulin is one of the most underappreciated blood pressure hormones. When insulin levels are elevated, the kidneys start to retain sodium. They just stop letting go. And as a result, your kidneys hold on to sodium and they hold on to water, and that in turn causes your blood pressure to go up. And this happens even if the sodium intake hasn't changed at all. This is why people with insulin resistance or prediabetes or type 2 diabetes often end up with high blood pressure. And it's also why blood pressure often gets better when insulin levels drop, even before someone loses much weight. So this is another reason why cutting out processed foods and refined carbohydrates and sugars helps your blood pressure even more than a low salt diet. Salt or sodium can temporarily raise your blood pressure, but it's the persistently high insulin levels are what turns this into a chronic problem. And this is also where fructose enters the picture. So fructose is just a simple sugar that's used as a sweetener or as a preservative in many of the processed foods. And I often talk about the problems with getting too much fructose in my other videos, especially when it comes to fatty liver. But when you consume a lot of fructose from processed foods or drinks, well then your body makes a lot more uric acid. And that's one of the things that causes high blood pressure, because high uric acid gets in the way of nitric oxide, which is supposed to keep your blood vessels relaxed. And it also makes blood vessels stiffer, and it makes it much more challenging for your kidneys to get rid of sodium. Uric acid is actually one of the labs I routinely check in all of my patients, especially if they have high blood pressure. And I've seen many cases where blood pressure comes down back to normal simply by cutting down on fructose and lowering uric acid. And if diet alone is not enough, we sometimes use a medication called allopurinol, which most people know it for gout, but it can also help with blood pressure if it's the uric acid that's the cause. But the bigger point is this: if you cut out sugars and if you cut out processed foods, well, that helps both your insulin resistance and your high uric acid levels. And it's pretty remarkable how fixing just these two things can rapidly reverse your blood pressure, even without your typical blood pressure medications. And this is the theme that you'll keep noticing. High blood pressure isn't caused by one big mistake or one big reason. More often than not, it's caused by many small physiologic stresses that just add up together to cause big problems. Now, another major piece of the puzzle that often gets ignored is potassium. So potassium works in two main places in your body. First, it works in your blood vessels and in your kidneys. So potassium helps blood vessels relax, and it tells your kidneys to get rid of extra sodium in your urine. So it basically counteracts sodium retention, which then lowers the pressure inside your blood vessels. And second, potassium also works in your brain. So when potassium levels go up, especially in the brain and in the cerebrospinal fluid, it turns down the sympathetic nerve activity, which is basically your fight or flight system, the system that typically raises your blood pressure under stress. So by calming that signal, potassium helps quiet the nervous system, and it reduces the hormones that normally raise your blood pressure. And the reason I bring this up is because our typical modern diets are very low in potassium and very high in sodium, which is the opposite of what supports a healthy blood pressure. And this imbalance alone can push your blood pressure up even if your total sodium intake doesn't look that high. And then when you combine low potassium with high insulin and high uric acid and low magnesium, well, this is the perfect storm that makes your body hold on to sodium and keeps your blood pressure elevated over time. So if you want to add more potassium to your routine, well, my personal favorite foods would be root vegetables. So it'd be things like potatoes or sweet potatoes. And then vine fruits like tomatoes and cucumbers and eggplants. Leafy greens like spinach are also high in potassium. And don't forget legumes like chickpeas and beans and peas. And those things will also give you a lot of good fiber. And by the way, if you're keeping track, a lot of these foods will also help you get more magnesium in, so you get a double benefit. Now, this isn't a full list of all the things that can raise your blood pressure. What we haven't talked about is how other micronutrient or vitamin deficiencies can also play a role. So it'd be things like vitamin D or B12. We haven't talked about homocysteine because that matters too. And so do stress and sleep and even secondary endocrine disorders like primary aldosteronism, which actually shows up in anywhere from 8 to 20% of cases of resistant high blood pressure. But I'm going to go deeper into those topics in my future videos. The key takeaway is to address these factors early, before the damage in the blood vessels sets in. Because once the damage builds up, and your blood vessels become stiff and lose elasticity, well, that's when high blood pressure becomes much more difficult to reverse. I hope this is helpful. Stay healthy, and I'll see you in the next one.